Welcome to Healthcare 321. It's a show about the future of healthcare and kidney health. We're your hosts, Tim, Lillian, and Alice. We share more about who we are in episode 0, why we're having these conversations, and what we hope to learn with you along the way. But today we are talking about value-based care, and we're joined by Eugene Lin. Eugene is a nephrologist, health economics researcher, and assistant professor of medicine at the University of Southern California. He is an expert on health economics and health policy issues related to kidney diseases. His research has been featured in high-impact publications, including JAMA, JAMA Internal Medicine, and Health Affairs. Eugene, welcome to the show.
Yeah, thanks so much. I'm thrilled to be here, and I'm excited to learn from y'all.
So Eugene, we asked you to come on the show because you're an expert in analyzing how healthcare policies and economic models, particularly those involving value-based care, impact the delivery of kidney care and patient outcomes. So you are our expert for today.
Yeah, and I'm really excited to bring an academic perspective to this topic. And I'm equally excited to learn about your perspective when it comes to what the corporate sector is thinking, and also how providers are innovating in this area. I think it's probably useful to start off at a high level, just defining what value-based care is for our listeners, because we may not all be on the same page. And when I think of value-based care at a high level, I think of a policy that a health insurer, be it in a private insurance company or the government, implements a set of payments that allows providers to respond to carrots and sticks. And in general, you can think of this as paying providers for high value care. You could think of that in, air quotes, broadly defined as cost saving and or high quality care, or penalizing providers for low-value care, which would be the opposite. And, the question is, why do we see an emergence of value-based care? And we see this because insurance companies, by definition, are in the business of taking on financial risk. And financial risk for health insurance companies or the government generally takes the form of costly, unpredictable care that renders the health insurance company or the government not profitable. And value-based care is a way to try to share that burden with providers.
Yes, I was going to say thank you very much for that definition, because, quite a few times we run across people who want to know what value-based care is about, and this includes physicians, it includes patients. They want to know how they're impacted. It was also one of the most popular posts team conversation about VBC and how it affects both payers, patients. So thank you for stopping by and helping us understand the basics of value-based care.
Yeah, I would just jump in and say, you may notice that I left the definition very broad. And the reason for that is because there are a lot of different flavors of value-based care. I mean, it's kind of like Baskin Robbins. There's more than 31 flavors, right? And there really are a lot of different versions of this, and really the devil's in the details. Some of the value-based care models are very effective and have demonstrated savings in value, and many of them have not. And really, when we talk about value-based care to our patients or to providers or to insurers, we really need to be talking about a specific model and thinking about how you design a model that effectively achieves the aims that we want it to achieve.
Eugene, hold that thought, because I have another question for you down the line as you start to talk about the different models. But I'm going to throw it back to Alice. I guess the question is, why are we talking about value-based care now, right?
Are we talking about value-based care now? For me, I will share that I think that value-based care sort of encompasses the zeitgeist of healthcare today. Right? Healthcare has been extraordinarily expensive for our country. we spend trillions of dollars on healthcare, 5 times the budget that we spend on military, and going up, right? But we have not really seen positive outcomes from all that spending. So, Eugene, actually, I was curious, why do you think patients should be aware of value-based care is? Is this something that just physicians and providers need to know about, or do you think patients also need to know about value-based care?
No, absolutely. I think patients for sure need to at least understand, or let's put it this way. I think that it's incumbent on providers to help patients understand what it is that we're trying to accomplish when it comes to delivery of optimal health. Because you can think of healthcare as a series of transactions of services that a doctor provides, or a nurse practitioner provides, or a pharmacist provides. But ultimately, it only matters to the patient if their health is improved. And so what we really need to make sure that patients understand is that we're not here to just do a bunch of stuff to make money. What we're trying to do is we're trying to work together as a team to make sure that the patients that we're treating, that their health is improved. And how can the government or health insurance companies be involved in designing a system so that our ultimate goal is health and not just health care? And ultimately, I think that's what we want as providers as well. I think that's why many of us became interested in becoming doctors, or pharmacists, or nurse practitioners, or provisioners of healthcare. We're not interested in the healthcare. We're interested in health.